There is a growing recognition that eating disorders like anorexia nervosa, binge eating disorder, and bulimia may not arise solely from psychological or sociocultural factors. Emerging evidence suggests that impaired microbial signaling and disrupted gut sensing mechanisms may contribute to these complex conditions by distorting appetite regulation, emotional processing, and reward sensitivity. This represents a paradigm shift from viewing eating disorders only through the lens of behavior or trauma to acknowledging that the gut-brain axis, particularly through microbial communication and neuropod signaling, may provide a biological substrate for disordered eating. At the heart of this theory is the concept that the gut is not just a passive digestive tube, but a highly sensitive, intelligent sensory organ, populated by trillions of microbes that interact with specialized cells and neurons to deliver real-time data to the brain. Neuropods, enteroendocrine cells, immune sensors like TLRs, and the vagus nerve form an integrated network that continuously informs the brain about nutritional status, microbial balance, and energy availability. If this feedback system is disrupted by microbial imbalance, inflammation, or damage to gut neural circuits, the brain may misinterpret the body's actual state. Hunger might not be recognized when the body is starving. Satiety may not register after a binge. Emotional regulation might falter, and food may feel threatening or compulsively desirable, depending on how gut signals are misprocessed. In anorexia nervosa, for example, multiple studies have shown that patients often exhibit profound microbiome dysbiosis, a loss of microbial diversity, lower levels of SCFA-producing bacteria, and an overrepresentation of species associated with inflammation. These shifts not only impair gut barrier function but also reduce the production of microbial metabolites that are essential for signaling satiety, calm, and reward. Butyrate and propionate, normally key drivers of GLP-1 and serotonin release, may be drastically reduced. This may contribute to the blunted appetite and heightened anxiety that often persist even when caloric intake is dangerously low. Paradoxically, starvation may be experienced not as hunger but as control or clarity, potentially because gut-derived reward signals are suppressed or misrouted due to microbiota-induced alterations in vagal communication. Animal studies reinforce this idea. When mice are subjected to dietary restriction or stress, their gut microbial populations change rapidly, leading to altered vagus nerve signaling and shifts in dopamine sensitivity in brain reward regions. In some cases, germ-free or antibiotic-treated animals exhibit behaviors strikingly similar to restrictive or compulsive feeding patterns, suggesting that microbial cues play a role in regulating not just energy homeostasis, but behavioral patterns tied to reward, control, and compulsion. On the other side of the spectrum, in binge eating disorder, BED, and bulimia nervosa, the microbiome also appears to be altered, but in different ways. These individuals often show increased levels of LPS-producing, inflammation-promoting bacteria, lower levels of Akkermansia mucinifila, and changes in the production of appetite-regulating neuropeptides. The result is a feedback loop where satiety signals are delayed or weakened, while reward-seeking and impulsivity may be heightened. SCFA deficits impair vagal signaling, while excess gut permeability may allow microbial products to reach the brain and stimulate dopaminergic pathways, amplifying the sense of urgency around food. Emotional eating and binge episodes may be further reinforced by this disrupted gut-brain chemistry, making behavior difficult to regulate even in the absence of hunger. Recent findings also suggest that neuropod cell dysfunction may be a key player in this equation. These synapse-forming gut sensors not only detect nutrients, but also respond to microbial metabolites. If they are damaged by inflammation, microbiome shifts, or trauma, the clarity of gut-brain communication is reduced. Hunger and fullness become noisy signals. Decision-making around food is no longer grounded in physiological reality, but in a confused swirl of reward anticipation, guilt, aversion, and emotional volatility. This may help explain why many eating disorders defy rational intervention. The brain may be acting on distorted information coming from the gut. Perhaps most striking is the bidirectional nature of this relationship. Disordered eating changes the microbiome through restrictive patterns, purging, or overeating, and the altered microbiome, in turn, reinforces disordered patterns by shifting the internal signaling landscape. This means that even after the psychological impulse to restrict or binge begins to subside, the gut-brain axis may still be promoting behaviors associated with the disorder. This may help explain the high relapse rate seen in treatment and underscores the need for interventions that target not just cognition, but also microbial restoration. New therapies are beginning to take this biological model seriously. Pilot studies using fecal microbiota transplantation, FMT, targeted psychobiotics, and prebiotic-rich diets are being explored as adjuncts to therapy. While still in early stages, the goal is to reintroduce beneficial microbes that can restore the gut's ability to signal satiety, reward, and emotional balance more clearly. The long-term hope is that by repairing the gut's sensory circuits, we can make recovery from eating disorders more stable and biologically supported. In conclusion, the role of gut sensing in eating disorders is not fiction. It is increasingly a scientific frontier with transformative implications. Impaired microbial signaling and distorted gut-brain feedback loops may underlie some of the most puzzling features of anorexia, bulimia, and binge eating. Recognizing this opens up new pathways for treatment that go beyond willpower and psychotherapy and into the terrain of gut ecology, neural communication, and sensory rehabilitation. The gut, once a silent player in mental health, may now be recognized as a co-author in the story of disordered eating and, potentially, a guide toward healing.